Hey there everyone, my name's Dr. Daniel Ness. I'm a hair transplant surgeon here in London, and I'm starting this YouTube really to give you a good idea about where I'm at in the hair transplant world and hopefully help you a little bit with anything that you're worried about or wondering about with hair transplants, because obviously you must be thinking about it a little bit to be on this channel. But I've been doing hair transplants for 6 years. I've done well over 1,000 procedures, and I thought about it a lot. You know, I've had a hair transplant myself, and my life, you know, I dream hair transplants, wake up thinking about hair transplants. All I think about is hair transplants. So hopefully you guys like my channel. Please like, subscribe, and leave a comment. Means a lot. And yeah, hopefully we get a nice little bit of following here. So anyway, I thought we'd start with a bit of a video on debunking some myths in hair transplant. But to be honest with you, I think at first we probably need to talk about the way that I see what a hair transplant actually is. And the way I see what a hair transplant is means that you need to understand what hair is from my perspective. So you might not have ever really thought about hair in this way before, unless you've done hair transplants day in, day out for years. And even if you have, you may still never have thought about hair in this kind of way. And the reason why I wanted to talk about this is if we talk about what hair is, then we know how a hair transplant can work and how it can look good and how people can never tell that you've had a hair transplant. But if you don't understand what the hair on your head is doing, then you can get yourself into funny little avenues, pathways, going down the wrong place, and it end up with something that doesn't quite look good. So, because you need to understand what hair is from the beginning. So the way I look at hair is if you shave someone's head, it becomes a lot clearer. But hair is an arrangement of something called follicular units on the head. We're only talking about scalp hair at the moment. Now we look at other areas of our body and see hair at a shorter length and understand that better, like the hair on the arm, face, chest. But these areas the hair just grows out as single hairs. So most people think it does that on the head as well, because to be honest, not that many people with full heads of hair are walking around with shaved heads. Usually the guys walking around with shaved heads have no hair. But if you look at somebody that's got shaved hair and you look at it really, really short, you'll see that the hair grows out not as one hair, one hair, one hair, one hair. It grows out as one hair, two hairs, three hairs, two hairs, one hair, two hairs, three hairs. There's a very complicated pattern, and that's a key word, pattern of hair, follicular units. It ends up being hair, it produces hair. It's a bit like apples and apple trees. The follicular unit makes the hair, which is what you see. That's what grows out. That's what everyone walks around with. That's how you end up with a fringe. That's how you end up with all of this. But ultimately, if you shave it right down, you get right down to it, you look at it very closely, you magnify it. What is it? It's a complicated pattern of bundles of things that make hair. And knowing that means that if you want a good hair transplant, the arrangement of the hair needs to be natural. I thought I'd start with, just debunking some myths, because there's a lot of myths out there about hair transplant. And, we could go on all day, but, I just thought we should, debunk perhaps 5 of them that are personal to me, perhaps. But yeah, the first one obviously is hair and I'm sure your friends will tell you this, when you're ready to book, you're ready to go for a hair transplant, you're ready to do something about your hair loss, and people will tell you, oh, but it's gonna look fake, it's gonna look like a hair transplant. It can't be done where it looks good. But we've just discussed that. We've just talked about what hair is. How it's not easy. We have to get that right natural arrangement. We have to recreate what could have been there without human involvement. But it doesn't mean it can't be done. And you can look at my results. There are many surgeons making really, really, really nice results. Hair transplants, for starters, can look good. There are many high-profile people out there with amazing looking hair transplants. You've got Machine Gun Kelly, you've got Joel McHale, you've got a lot of great looking hair transplants out there. So, that's just obviously not true. Second myth, You get more grafts with FUT than FUE. Okay, this is a slightly more nuanced discussion, but the biggest hair transplants in the world are done by people who do FUE. At the end of the day, you can look them up. The biggest hair transplants done are done by people in single sessions, in multiple sessions, are always done with FUE. Nobody is doing, 13,000, 14,000, 15,000 grafts with FUT. It's not happening. There is a discussion about how much more you can get out of the donor if you do FUT first. And this comes down to a topic called the safe donor zone. So, way back when they did studies looking at what kind of hair men would be left with in their 80s, and perhaps even beyond that and before that. And this is when they were doing FUT. FUE wasn't really much of a technique at that point in time. FUT dominated hair transplant in the 1990s, and when they started looking into it, they wanted to, because it's an aggressive, invasive procedure. They wanted to make sure that the hair that they were taking, the scalp that they were cutting out, and the hair that they were taking from that piece of scalp, they wanted to make sure that that would last for the whole patient's life. Of course, if you're going to be doing something like FUT, you would want that hair for 100% to last your lifetime. The problem is that the vast majority of men do not go that bold, even at that age. Look at Ronald Reagan. He died with a full head of hair, and he was 90, I think, or somewhere like that. So, the other thing is, even if you are going to lose a lot of hair in your 70s and 80s, you still may keep quite a lot of hair around the periphery of the back and sides well into your 60s, well into your 70s. If we go back to what hair looked like and how hair is supposed to look like, nobody's head of hair naturally has a massive linear strip of bold scar tissue at the back. So straight away, you can't have your hair shaved short. Straight away, you have lost the natural arrangement of hair and permanently lost the natural arrangement of hair on your head. So if you're going to do the FUT route, I would say it's a pretty big decision. And if somebody's selling that to you as, this is something that you should definitely do because you'll get more grafts, you should take a step back and say, hey, am I going completely bald? If you're not going completely bald, you don't even need to worry about FUT. You're not going to need the amount of grafts that maybe you'd be able to get more with FUT. Are you going to be on medication? Because if you're on medication, your hair at the back of your head is going to be much more permanent. The hair on your top of your head is going to be much more permanent. It's a question of risk. But there are very few patients. The only ones is people that are going to lose hair at the donor site. Those patients, yes, may benefit from getting more grafts with FUT if they are happy losing the natural arrangement of the hair on their head. But for everyone else, it's not worth losing that natural arrangement. FUT will always look like a hair transplant at a certain length. There's no getting around that. The other patients who get pushed towards doing FUT are females, and I do a lot of female transplants. I do probably more female and transgender hair transplants than definitely maybe anyone else in the UK, maybe anyone else in the world. I don't know anyone else. I've never met another hair transplant surgeon who's doing as the frequency of transgender and female sessions as I'm doing. And of the people that are even close, they're almost always doing FUT, but I am doing FUE for all of these patients because the average female usually needs 2,000, 2,500, maybe often much less grafts for their hair transplants. And you can shave a nice little window in the back of the head. If the hair is long and thick enough, you can take the grafts out of that shaved area. It will grow back with visually the exact same density, the exact same fullness, the exact same volume. They don't have a scar on the back of the head. They don't have a long, painful recovery. Within a couple of weeks, nobody else can even find that shaved area again if the hair is thick and long enough at the back. Yes, again, if there is a question about the donor quality, if the hair is already thin at the back of the head, if the female transgender patient already doesn't like the density and the volume that they have at the back, then again, perhaps FUT may be considered. But in all honesty, in 2026, you shouldn't really be, there is a very, very small number of patients that may benefit from FUT, and for to permanently lose the natural arrangement of hair at the back of your head, and the back of your head is so important. I mean, people don't worry about it because they're not the ones looking at it, but people will look at it when you're sitting on a train, when you sit in front of somebody at a stadium, when you're walking down the road on a crowded street. If you've got a massive scar on the back of your head, people are going to notice. And, you know, for me, it's not worth it. So, yeah, the other head, I suppose we came on to the other myth, really, a little bit with that talk, was hair transplants are for bald people. Well, not really. I mean, hair transplants are obviously a good treatment for somebody who is bald, who's somebody who has significant hair loss. But you can put hair anywhere. You can put hair where hair never grew. I'm not saying you should, or sometimes, but hair transplant, I'm a great believer in hair transplants for people who have never lost hair. I do a lot of them. I do hair that could have only grown on somebody born a female, they were born a male. I do hair transplants on somebody that never had temporal points. They just never had them. Their hair, they never lost hair. They just had a big forehead and they wanted to look more attractive, because ultimately that's the reason why everyone's doing it. And hair transplants look great on people who are bald. They look great on people who are not bald. They look great on people who've never lost hair. If it's possible, if it's safe, if it's achievable, then why not? You know, if you got the money to do it and you are wanting to change your appearance, this is a safe procedure that you rapidly recover from, and if done properly will leave you with absolutely no problems going forwards. So yeah, hair transplants are great for people who have never lost hair, just as they are for people that have. Coming towards the final couple of myths, there's many more. You know, if you got any questions about these myths, if you got your own myths or things that you're not sure about, I like getting involved in a debate. So, you know, just throw a comment out there and I'll respond. If you want to, test me on some sort of theory, or test me on, you know, maybe go back to the first myth where we said about the 10, 12, 13,000 procedures, because you get another myth from people saying that you can't do more than 4,000 grafts. So yeah, I mean, throw your comments out there, I'll respond. But the other myth is beyond medication for life. You got to take finasteride forever. I don't want to take that. I don't want to take any of these pills forever, so I'm not going to do a hair transplant. If I take those pills, my hair is just going to fall out. My hair transplant is just going to fall out. So I don't want to do it. This is absolute garbage. You know, there is a strong role for medication in hair loss. Medication will stabilize your hair. If you are going bald, if you are not going bald, then you have to make a decision about hair loss medication in exactly the same way that you would make it if you weren't going to have a hair transplant. I've had a hair transplant. I don't take finasteride. Finasteride doesn't work that well on the front. It doesn't work that well for that slightly maturing kind of hairline that people develop if they make the hair if they keep the thick hair on the top of their head, thick hair around the back sides of the head. There's really no role no warrant to be on finasteride for the whole of your life. Absolutely not. But if you're going bald 100% and you want to do a hair transplant, then you should be on finasteride. I'm sorry, you're not going to get a good result. The reason for that is not really that finasteride is going to stop you from going bald. It's because the finasteride will massively improve the availability of donor hair for a hair transplant. Not just the availability and the numbers, but the quality of the hair will be significantly improved. So if you're completely bald and you're looking at 6,000, 7,000, 8,000 grafts, you know, you're going to get 6,000, 7,000, 8,000 much better grafts. And maybe you're not even going to get them at all without being on finasteride. So final myth, hair transplants give you instant results. So, you know, most patients these days do understand this. You do go through this shedding period. You do go through this, what they call the ugly duckling phase. Month 1 to 3 is not great. But you do get the odd person that either they didn't understand it, perhaps their wife didn't fully understand it before the guy had a hair transplant. The follicles normally are shocked by moving from here to here, being poked and prodded, going into ice, etc., being deprived of oxygen. Usually the hair shaft, and remember the hair shaft is dead tissue made by something called the follicle, which we are transplanting. It's a bit like moving an apple tree to one side of the garden to the other, and maybe the apples fall off. Doesn't mean that the tree's dead, just means that the apple, it decided to shed the apples. Same thing with the follicles. Sometimes, most of the time, it will shed the hair. And it takes a while. It takes about 6 months to start looking good. But even then, you're only about 60% of the result. 12 months in, should be looking really, really good. That's kind of your fun. It will slightly improve after 12 months to about 19 months, but essentially you're at the final result at 12 months. Anyway, that's been me, Dr. Ness. I hope this has been helpful. Please like, subscribe, and yeah, welcome to my YouTube.